Hi, my name is Karen. I'm with Elderly Care by Karen. In today's episode, we're going to talk about medical terminology and taking your parents to the doctors. Seniors need to visit their primary care doctor on a regular basis. Depending on the health issues that they're dealing with, this could mean every 3 to 4 months for a checkup. It's also recommended that people over 65 get their eyes checked every year to monitor for cataracts, glaucoma, or other eye problems. If they begin to have any symptoms of something new, do not hesitate to take them in. If it seems serious, like a major change in behavior, fever, falls, trouble breathing, or pain anywhere, take them to the emergency room. Don't hesitate. Any pain or a fall or sudden change in behavior for the elderly can be a sign of stroke or even a heart attack. This can't wait. The sooner they get treatment, the less long-term damage there can be from the illness. If your parent's taking a blood thinner like my dad was, or even a daily aspirin, any fall can cause internal bleeding. They need to go to the ER to get an MRI done immediately to check for internal bleeding. One time my father fell in the bathroom and bumped his head, and even though that day the MRI didn't show any bleeding, about 3 weeks later he started acting strange. So I took him back in and they did another MRI, and that one showed that there had been a slow bleed in his brain, and they found a pool of blood called a hematoma, putting pressure on his brain. Now, regular follow-up appointments would be with your parents' primary care. This doctor is going to refer your senior to any specialists that they feel are necessary. And here are some of the common types of specialists that your parent may get referred to and what their specialty is. What do these specialists do? First of all, because so many seniors have ongoing issues like high blood pressure and cholesterol and diabetes, these are chronic problems. It's recommended for elderly to use an internist as their primary care doctor. The internist, our internal medicine doctor, specializes in the chronic long-term issues like diabetes. Other doctors that they may get referred to are a cardiologist, who deals with the heart or circulation. A urologist treats the urinary tract and prostate issues. Again, with going back to the eyes being checked, rather than just going to a regular optometrist, elderly should go and see an ophthalmologist. This is an actual doctor who can treat eye issues like glaucoma and cataracts and can prescribe medicines for them. A nephrologist is someone who can treat the kidneys. A neurologist deals with the nervous system and the brain. A podiatrist deals with feet and ankles. Pulmonologist deals with things affecting the lungs or even sleep apnea. If you feel that they are holding their breath and snoring a lot and having a hard time breathing at night. A gastroenterologist deals with issues affecting the esophagus, the stomach, digestive tract, and the intestines. An oncologist is your cancer doctor. They deal with anything related to cancer. Orthopedic surgeon is someone who will treat bones, like if they fall and have hip problems or spine issues or sciatica and their, pain going down their legs. A rheumatologist treats arthritis and rheumatic diseases. And the final specialist is a wound care specialist. And this is someone who is a medical doctor, but he specifically treats chronic wounds that won't heal. Other medical professionals may include physical therapy, and the physical therapist works with patients to strengthen and reduce pain from the lower half of the body. So your legs, dealing with your balance issues, and building up physical endurance. An occupational therapist works with strengthening and reducing pain in the upper half of the body. So the arms, the shoulders, the hands, the neck, and any kind of activities that they would be doing around the house, like how to write a check or brush their teeth, things where they have to use their hands. A speech therapist will work with the patient on a variety of issues from swallowing problems to cognitive issues and speech issues. You may also have a home health aide coming into the house to help with some personal care, such as bathing or dressing. Now, some of the common medicines that seniors are usually on are different blood pressure medicines, cholesterol medicines, things for diabetes, so your blood sugar medicines, kidneys, especially if they are diabetic. They're also treating the kidneys to prevent any damage to the kidneys from the diabetes. Blood thinners, if they've had any kind of heart surgeries, asthma or lung issues, for example, the COPD. Seniors tend to run low on vitamins because they don't eat as much or maybe as well as they used to. So they may be required, but their doctor may ask them to take extra vitamins such as vitamin D or vitamin E or iron. So hopefully some of these will help with your parents, and I hope that you have a better understanding of who you're going to see and what they can do for your parent. Thank you, and we'll talk to you again next time. Bye.